Okay, so hi Radhika, hope you're doing well. So please introduce yourself to our audience today.
Hi Subhav, thank you for inviting me to your show. I'm Radhika Kotak. I'm a third year medical student from India.
That's all.
Yeah,
That was
that's
a
all.
short
Sure.
and crisp introduction. So tell me more about your Instagram and Studygram page, and that's how we connected, right?
Okay, yeah. So basically, in April 2020, I was scrolling through Instagram and I came across your Instagram along with a lot of other studygram pages, and I was like, I can do something like this. I make pretty good notes. So I started a page and I was like, what should I call it? And my dad was like, you call yourself Rad, no, then just use that. I was like, okay, I'll use that. And then that's how the name came up. And then I started my account, and it was a whole different world. Like, my idea was just to share my notes and learn something and be productive this lockdown, because I really didn't expect it to be this big in just a short amount of time. But I'm really happy that I started Radmit, and it's one of the best things.
Okay, so you are Radmed Go to many people. They don't know you as Radhika. So now that you're in third year, you finished your third year final exam. So this is a perfect opportunity for you to tell us, everyone, how third year medical school in India is like, and hopefully many people can learn from it. But first question I have for you is, many people say that in India the third year is the most boring year in medical school. Is that true?
Uh, I think I will agree on that, because third year subjects are quite volatile and monotonous when it comes to PSM, especially. But I think with the clinical postings, which we didn't have, it got
Okay.
even more boring. So I think for people who will start the clinical postings for ophthalmology and ENT, it won't be that boring. But for the lockdown batch of third year, definitely a big bore.
So you agree it's the most boring year in medical
Yes,
school
I
in
do.
India. So it has subjects, let me run down: ophthalmology, ENT, and PSM,
Yes.
right? So we'll talk about all these three subjects in detail now. So which is your favorite out of these three? We'll start with that.
Okay, so ENT, because
Okay.
that was the only one I was decent at.
But I saw you on your Instagram page, lot of ophthalmology notes, ophthalmology, knowledge you were giving on your studygram. So I
Yeah,
thought that might be your favorite.
not at all.
Okay. So ENT, let's begin with that. So tell me, how did you study ENT first? And then we'll move on to how you think, what the resources should you use, books people should use. But tell me first about your experience. How did you do in ENT and how did you tackle it?
Okay, so I think I did good in ENT, and especially my vivas, they were really good. Uh, but something about ENT is that you have to know the anatomy and the physiology really well in order to understand the pathology, which is in basically anything
Which
in
is
medicine.
everything, yeah.
Yeah. So I started with anatomy back in January, because that's when I started third year. So I started with ear
Okay.
anatomy, nose anatomy, and throat anatomy. And trust me, I'm not good at anatomy. I
High
mess up a
five.
lot. I mess up a lot. And it was like learning anatomy is quite difficult for me because I've always been scared of it. But in third year, I let go of that fear and I actually started liking anatomy. So
Wow.
after that, I moved on to physiology of hearing and all of that. And then I came to reading the actual diseases from DINGRA, which is the standard book for ENT in India. And
Okay.
Marrow is also really good for that. Like Manisha ma'am is amazing. She is just amazing. So she was really good, and that's how I studied ENT.
Okay, so what books and resources should one use apart from the standard which you already said, Dhingra? What books and resources one can use if they want to tackle ENT in medical school?
Okay, so there's this marrow modules are definitely one of the best way to revise. Apart from these two things, I didn't really use anything else for ENT. But for the anatomy and physiology, I used osmosis videos because they're really good. They're really crisp and
Yeah,
well to
I've
like
seen
good to
those.
understand and everything. So I used osmosis, and for ENT, it's just that you have to keep revising. And for us, we really didn't have any clinical exposure for ENT. Like we didn't see a single patient, we didn't see anything. So for us, everything was inside a book. There was no patient, there was no clinical exposure, there
Yeah,
was no going into the OT to see tympanoplasty, nothing. So I think that for
yeah,
the upcoming people, what I would suggest is that they should definitely attend their postings. They should definitely take the OT experience if they start, obviously, because a lot of hospitals are still not teaching in clinical postings.
yeah.
They are just taking lectures online. But if they do take you to the OT, or if they do ask you to take history of patients and all, do it, take it, understand it, because that's the best way to learn anything in medicine.
Sure, I agree with you. So, let me clear one thing. You studied anatomy, physiology, and then moved on to the pathology part, right?
Yes,
So, anatomy and physiology, as I understand, is not included in the ENT course, right? You
no,
must study it yourself.
yes,
So, most people would not do it.
yeah,
But that was your approach, that you understood that you should first master the anatomy or physiology, or at least revise it once more before you start the pathology part. And that's, I think, really good, because uh, even I like to do everything system wise. And I think in India, as well as where I'm studying in Armenia, we do more of a subject wise curriculum. Like we study anatomy, we study physiology, we study pathology separately, rather than studying the cardiovascular system, the respiratory system. So, what are your thoughts? Do you feel subject wise is better or system wise?
definitely system wise is better. Like from first year, second year, I in second year also I revised my anatomy and physiology alongside pathology, pharmacology, because
Yeah,
it's not possible for one to understand something abnormal. Pathology is basically abnormal physiology. So if you don't know the
yeah,
normal one, you can't really understand the abnormal thing. Okay, and also with histology, like associated with anatomy also, if you don't know how to identify a normal organ, how will you identify the pathology? Like it's not possible. It just doesn't make sense to me if you study subject wise. So I think especially after
yeah.
coming to the clinical years, like third year and final year, we definitely have to go system wise, or else I don't think people will actually understand what the entire disease is about.
Yeah, I wish I knew this tip sooner when I was back in my second year and first year. I would have studied system wise, but here we are anyway. So, one more thing, you mentioned that you didn't have any clinical exposure regarding your third year subject. So, how did you tackle that? Did you see YouTube videos or something?
Yeah, okay. So I was extremely frustrated at first because I was not understanding a lot of things, especially the surgeries. I was like, okay, you're doing this, but why? Explain why are you doing this? So it
Yeah.
was not there. So there's this channel, White Army, on YouTube, one more channel. So I watched their videos randomly. Like I just searched like some clinical experience for ENT, and that came up, and I watched them and their videos. Apart from that, I think I couldn't really get much of clinical exposure out of YouTube because it's not really possible. They don't really have videos of tympanoplasty or FES or
Yeah.
tonsillectomy going around. In my Viva also, I
Yeah.
was asked to pick two instruments and differentiate between them. Okay, so it was an esophagoscope and a bronchoscope. So I had
Okay.
just crammed the difference because I didn't know how to use those two things because I had never
To
seen
use it.
anyone use it in front of me. So I was like, yeah, so bronchoscope has vents, but esophagoscope doesn't have vents. And he's like, yeah, but how will you use it? How will you use it? How long is the esophagus? I'm like, sir, let me just breathe 1 second. Let me just breathe and let me answer. But then he was like, oh, I forgot that you are the lockdown batch. Okay, okay, I'll spare you some. I'll just show some sympathy to you, and I won't ask you about anything clinical. Then he was like, you should go and see it in the clinics because you won't understand from your Instagram and YouTube. And I was like, okay, sir, I'll surely make sure that I go to the OT and watch the procedures. But it's just that on YouTube, it's not possible to actually, get an idea about how the procedure
True.
is going. And because basically surgery is associated with anatomy. So I knew the anatomy part, but okay,
Do
but
it,
how do
yeah.
you like how is the probe reaching the tympanic membrane or how is that happening? Can you explain it to me? But no, YouTube couldn't explain it to me. So I think I'll be going to the hospital this year and seeing it for myself.
Okay, so that's how you'll revise it back, let's say, your third year.
Yes.
Cool. So that's how you tackle the clinical part of your third year. But now coming to the exam part of ENT, just specifically on ENT, do you have some exam tips or study tips or some experience which can help people watching this or hearing this?
Yes. So if you have seen my page, I'm all
Yeah.
about mind maps and mini mind maps. So that's the way I study. Like I structure out everything the way I understand it. ENT is very straightforward. Like first you introduce the disease, like it's a chronic
Hmm.
inflammation of the tonsils.
Tonsillitis.
So if you are talking about tonsillitis, chronic inflammation of tonsils, and then we come to the causes, like what can possibly cause tonsillitis. Then we come to the signs and symptoms. Then we come to the
Hmm.
investigations, and then we come to the treatment part. So I think this is
Or
what is going to be followed in
medicine,
all
yeah,
clinical
especially.
subjects. All clinical subjects. So for theory exams, especially, you need to follow this pattern. You need to understand the course of disease in this pattern itself. So it will be easier for you to write it down in the exam. And I am very bad with theory exams. Like I will know everything, but I am still not able to write it down in a structured, detailed manner. I can't expand things because I used to make mind maps and
Yeah.
come. I still remember this one time. I started making mind maps from first year itself. I still remember my physiology professor who checked my paper. He called me. He was like, "What have you written?" I was like, "Sir, wait, I'll explain it to you." And then after, I had to explain him the mind map, and he was like, "Oh, okay, you've written it right. Let me increase your marks." And that's how I got like a
So you
distinction
made
in.
the mind map in your exam.
Yes, I did, and he didn't understand. He was like, "Where is this going? I don't understand where is it going." So then I had to like explain, like, "Sir, this is the procedure which I'm like, this is the cardiac cycle, and this is the pacemaker, and this is the heart sound you asked about." So it's like, okay. It's like next time,
Hmm.
please write how people can understand it. I was like, okay, sir, I'll make sure I don't do this in final exams. So I don't know about how my papers will be checked in third final, obviously, because I haven't gotten my results yet. But I'm pretty sure that I have improved my style of writing and I have made it possible for faculties to understand what I've written, and it's not just my brain inside the paper. So I have tried doing that, and I think just follow the pattern, just follow the definition, then the etiology, then the pathogenesis, if there's any, and then the
If
symptoms,
it's there.
signs, and all of that.
Yeah.
Just
Signs,
follow the
symptoms,
pattern.
diagnosis, and treatment.
Yeah, and I made notes for the long answer questions because long answers are like really long. So you can't really
Yeah.
study from the textbook and at the end time end moment. You can't. It's very lengthy to do that. So if you have time in third year and you can make notes, then make notes just for the long answer. Don't go all the way for the short answers. It's not worth it.
Okay. So making notes for long answers, that was one tip. Using mind maps, but just for studying, not on writing on the
Yeah.
exam. That was the second tip. And yeah. So that was about ENT. Anything you would like to add about ENT before we move on to the next
Just
subject?
start studying early. Just start studying early.
Start studying early.
Yeah.
How early is early for you? We are
right when
in day
college
one
starts.
medical school, third year.
Yeah, like
Okay,
day one
day
of
one of
third year
third
of
year.
med school. So you get to do opthal and PSM because PSM is vast. It's extremely
So
huge. It's
so
huge.
let's let's jump on to PSM then, shall we?
Okay. Yes.
Okay, so I think PSM, it's community medicine, right?
Yes.
PSM. So I don't have a subject called PSM here, but we have a, you can say, a brother or sister of PSM here, community medicine or public health, what we call it, different names. But I think they all belong to a community which people don't like. It's a boring subject, right? And I've not heard anyone liking PSM so far. I haven't come across anyone. Even for I thought the same for biochemistry, and then I found Anuj, who came on my podcast. He really loved biochemistry, so I was mind blown by that. Like some people can love biochemistry as well. So have you come across anyone, or are you the person who loves PSM?
Okay, so I'll be honest. When I started reading PSM, like thoroughly, religiously, it was during my
Yeah.
pediatrics exam actually, because one of my seniors told me that
Okay.
associate pediatrics with the OBGYN pediatric part of PSM and then study. So I was like, this is actually really interesting. It's not all that boring. But now I'm the person who dislikes PSM. I won't say that I hate PSM because I after I studied PSM I realized that it is very very important to be to become a doctor, a good one at that.
Yeah.
So you can't really ignore it. But yeah, I found out some hacks to make PSM a little more interesting and not all that monotonous, and especially to do well in your theory exams. PSM is boring to people because of the kind of font the textbook has. Firstly, the font matters a lot. People
Yeah.
don't emphasize on that, but the font matters a lot. If you can't really study from tiny fonts all day because PSM is vast and you're supposed to study it every day. You can't skip a day. If you have a schedule, then you have to associate ophthalmology and ENT alternately. But PSM is supposed to be done every day. So, what I used to do was I would study one chapter, like supposingly it's epidemiology. So, I would study like cohort study and case control study. So, I would read that and then I'd make a table. Like these two things fall in the same category, but they are different. So, I
I
used to
think.
make a table. And then I flipped the pages and realized that there's already a table made. And I spent hours making that table because I didn't read the entire thing. I was just like, let me just write it down because I was not able to read it. So when I'm not able to read something, I just write alongside. Like I'm reading 5 lines, I'll write it in my understanding. Like, this is what I understood. So that way. And then it was heartbreaking to see that there was already a table made. And I worked so hard to make a table which was like 2 pages long, and that was just like 10 points and done. And that was all I needed to understand those two studies. But okay, mistakes happen. So for PSM, it's very important that you study every day, you read it every day, and you revise every day because you are
Yeah.
not going to remember the peculiar details. And the worst part about PSM is that we are expected to cram the definitions and write them the way they are given in the textbook.
Okay.
And even in Vivas, I was asked, okay, define health. I'm like, okay, I'm gonna define health for you. I'm gonna say each and every word to you.
Every.
But yeah, because health, if you haven't learned it, if you haven't like crammed the entire definition, like health is good health. Okay, that's what someone's brain
Yeah.
would tell them at the first moment. Okay, so yeah, for PSM you need to cram the definitions. I used Anki for the definitions. Like I revised all of them every day via Anki, and that's
Anki is
how I
amazing.
remember my definitions well. I was like, okay, definition, ask me, I know that. It was like that. And for PSM, especially like if you're studying OBGY, nutrition, and all of those chapters, you need to make notes for them because just one day before the exam or just a few hours before the exam, you can't open this textbook. It's like a 1,000-page textbook. You can't read from it. So what I did was I just made like notes with headings, subheadings, and the important points. Like if there's objectives. So objectives you can't change the way it's written. You have to write it in the theory exam just how it's given. So I did that and I had to cram it. I was literally Hindi में if I say मैं झाप रही थी वो किताब को. I was like, let me just preach this book. It's the Bhagavad Gita of my life right now, and let me just remember each and every shlok that's written in it. So it was like that, because it's extremely difficult to remember that load of information, and that too extremely dry. It doesn't have any concept. Warning signs of mental health. This is a topic. Okay. 13 points are given, and I was like, even I have this. Get me a therapist first. Get me a therapist first. So it was like that. And I was even asked this question in my final exam. And I had crammed it so well because I'm like, I'm a victim of all these 13 signs. Let me just write my life story instead. So that way I think PSM is fun, but PSM is very boring also. So it's like a two-way street. Some chapters are really good. Some chapters are where you can actually relate to what you have studied before and what you are planning to study in future. And some topics are like, why is this existing? You question the existence of that topic because it's expired, like literally expired.
So this was your rant. I think we had a 1 to 2 minutes rant about PSM.
Yes.
I think every third year or fourth year medical student would be able to relate to you who have passed PSM. Like every word of this rant makes sense to me right now. Okay. So PSM, as I see, it's all about mostly about cramming. Let's not say all about cramming, mostly about cramming. But one particular thing people find it difficult to cram about is the national health programs, if I'm not wrong.
Yes.
You're having PTSD. Okay. So how to study these national health programs, how to remember it, how did you do it? Tell us all about it.
Okay, so I think by January I had posted a story on my Instagram where I said that I'm almost done with PSM, but the two most important chapters in PSM are left. Because that's Radhika for you, literally. So my friends were like, which chapters did you leave? I was like, national health programs and epidemiology, because I don't understand those two chapters. I just can't do them. So then later in February, when my exams were literally hanging on my head, I started studying national health programs. So my friend and I, we repeated those sentences and we crammed it together. But at the end of the day, when we were like, let's try and write it, and we were blank. We didn't know anything. We didn't know anything. So then we decided that for prelims, we are leaving national health programs. We can't do it. So for my prelims, I didn't study that. And it was asked as a LAQ. And I wrote everything about malaria from microbiology. They asked me epidemiology of malaria, and I wrote everything about microbiology, like the life cycle, the incubation period. And I was like, the cold stage, hot stage. I was like, and literally, people are asking me, what are you writing? What are you writing? I was like, I don't know what I'm writing. I'm just writing what I remember from microbiology.
Biology.
But then came the integrated vector control programs. So I was like, I have read this somewhere. Let me try and recollect something and let me try and make something out of it. And I know I've written everything wrong in that. I wrote mosquito repellents. I wrote odomos. I wrote mosquito nets, which is just like 1/10 part of the answer. And I didn't write the 9/10 part of the answer. So I'm pretty sure I failed that question, but I think I covered in everything else. So I got pretty decent marks in PSM. So then for final exams, I was like, yeah, I can't do this for final exams, I have to study it. So I started with watching videos about those natural health programs on YouTube, random videos. So it's like easy way to learn national health program for tuberculosis. This is what I typed. Okay, so then there were a few videos which explained the basic idea of what the tuberculosis program is, leprosy program is in like 5-10 minutes. After that, I took a sheet of paper and I wrote the headings, the objective, the idea, the component, dots, RNTCP, and then I started cramming it. Literally, the Bhagavad Gita, and I'm cramming. Because there's nothing to understand in national health programs. There's no concept in it. There's just trying to eradicate a disease, or they're trying to decrease the
there are a set
morbidity.
of rules.
Yeah, it's just a set of rules. Like they have some components and they have something. So I was like, I know the disease. Like I know what tuberculosis is, but I know the treatment also. But why is there a program? I don't understand, because I don't see this program anywhere. Like I haven't, and then they're like, this program is not in action anymore. I was like, then why am I studying?
Why are you studying it?
Why am I studying RNTCP when it's not really being practiced anymore? Like I should study dots instead, like the regiments and stuff. But okay, let's study it. If you're asking me to study for it, I'll study for it. So I made a list of headings, and then I wrote like only 3-4 points under each heading. Okay, and that's how I kept on reading it again and again till the moment it was literally tattooed in my brain, so that I can just vomit in the final exam and come. That's the only way out for National Health Program, and this is the easiest way, trust me. A lot of people, they try to remember everything. Instead of trying to remember everything, remember a few main points about each heading or subheading. PSM is a 1,000 pages book. Yeah, high. Not even high. Some of it is just, I don't even know why it is there. I have no idea why it is there. Like HIV also, we were asked National AIDS Control Program. Okay, so everyone was freaking out. Oh, AIDS is never asked. Why did they ask it? I'm like, they have asked, now you have to write it. You can't do anything about it. I wrote random things in the epidemiology, because again for final exam it was not, there's a set of past papers, past 10 papers, and it was never asked. So I was like, let me just flip through it and not really pay that much attention to it. And when this paper 2 comes, I'm like, oh, I have to write this. Going back to the normal, like the pamphlets and the rallies about AIDS and HIV, which happen all around the world, I think. So from that, I had written the answer about epidemiology. How there's a social stigma associated with it, how people treat people with HIV in a bad way. I made it an emotional answer. Like, I'm so sure that the examiner is gonna cry after reading that, because I made it so damn emotional. And then coming to the program, like the National AIDS Control Program, what I did was, I knew the components. I had crammed those 10 points. I was like, I'm gonna cram the shit out of this 10 points. So I crammed that, and then I wrote them exactly the way they were. And then I realized while writing it, they are all the same points. They mean the same thing. There's no difference. They basically don't want people to die of HIV. They basically want to eradicate the stigma and the discrimination associated with HIV. And it's basically the same thing. They want to prevent the transmission from mother to child. It's the same thing. It's not different at all. They have taken 3 points and expanded into like 15 points. It's just that. So I think if you pick that up early, I didn't. I made that mistake because I just read it like twice or thrice before my exams. But if you pick that up early, I'm so sure that you will understand that it's not really that difficult. You just have to get the 3 main points out of it, and you just have to change the grammar and write it. Because PSM is all about that. You have to expand a particular answer in 10 different ways in order to get marks. That's the thing about theory exams. They won't give you marks for writing for being really direct with your answers. Like That's the problem with me. I write extremely direct answers. I don't know how to make stories. The first
Yeah.
time I made a story was with this AIDS thing. I made it an entire
Emotional.
emotional thing because I actually have seen people being treated like really
Yeah.
badly when they are like, it's not their fault
HIV
they have
positive.
this disease. It's that doesn't make them any less of a human. These are the words I've written in the answer. It doesn't make them any less of a human. So I think you have to, get your knowledge, common sense and your general knowledge into action.
Everything.
If you don't know like how to write a particular national program answer, like it's
Have you
basically they.
seen Three Idiots?
Yes, of
So
course.
that this reminds me of that scene where Amir Khan, the protagonist, says the definition of a machine. He
Machine.
just explains it like, sir, up, down, anything from the pencil to the zip of your pant. He's like, ये लिखोगे exam में, you'll write this in the exam. So basically, you were that part, and what you needed to be was the part that comes afterwards, which says
Yes,
the definition,
of
crisp,
books.
clear of books if you want to pass. Yeah, so I
Yeah.
think PSM is like that,
It
right?
is like that. I think PSM demands a lot of your time and a lot of your memory. I was really worried for a moment that if I try to remember PSM, I will forget my entire life because it felt so heavy at that moment. I even had a small nervous breakdown right before my PSM exam. I was hyperventilating. I was like, I don't think I remember anything. I don't think I remember anything. It's all mixing in my head. Which program was what point was what. It's very, it's not volatile, but it's very lengthy. And lengthy things are definitely
Definitely
difficult to remember.
and
So,
annoying.
yeah. So, I just think that anyone who is watching this and is preparing for PSM, read it like it's your religion. Read it every day. You won't regret it because then later you get to sound smart in front of people in medicine postings and surgery postings. Because elements of PSM do come up in that.
You
That's
know the
what I.
prevention. You know the
Yeah,
prevention from
you know the
PSM.
prevention. You know how the programs work. You know what kind of medicines are being provided for free, for absolutely zero cost to
Yeah.
people who can't afford it. Like especially for the ANC PNC care, like for
Yeah.
the mothers and for the low birth weight babies. You should know what kangaroo mother care is. You should know all of these things because it will just give you an edge when you are in your OBGYN postings because these things will come up someday or the other. It's not always going to be like, okay, tell me what is multi-para gravida or what is this. No, a lot of who are the at-risk mothers, who are at risk for being a low birth weight baby.
Wait.
How do you prevent that? These all things are going to come up. So that way,
True.
yes, PSM is really interesting. But the other way, it's extremely boring.
Yeah. But I feel, let's say about 100% of the syllabus, let's say 40% might be relevant, 60% is just
Yes, definitely.
not relevant in
Definitely.
your future, I guess. That's just
It's not
my
even
take on
about,
it.
yeah, it's not even about being relevant. I think you won't remember it. You
Yeah,
won't
true.
remember it. You will literally be Ghajini after reading PSM. That's the case. Like I know I was a Ghajini after reading PSM. I didn't remember anything after the
That's
first
me
reading. I was like,
after reading Krebs Cycle, and after that, when I reached all the other cycles in
I
biochemistry, I was
actually,
like, what is
I
this?
actually started liking biochemistry towards the end.
You
I
start to
learned,
appreciate
yeah.
biochemistry after PSM.
I'm like, yeah, biochemistry was not that bad. It was actually good.
Okay, so I think our rant about PSM is over.
Yes.
And hopefully, from this rant, people can learn the importance and the not so important parts of PSM and the study
Definitely.
tips. So, now let's come to the last subject, which is ophthalmology, and then we'll move on to some fun parts later in the podcast. So, about ophthalmology, what is portrayed by your page as an audience of your page, an avid audience of your page? I felt, okay, this girl just studies ophthalmology. She is obsessed with ophthalmology. I don't know why. Maybe her aim is to become an ophthalmologist one day. Maybe her parents are ophthalmologists, or she is, something. So, what is this thing you like so much about ophthalmology?
Okay, firstly, I don't like
Oh, no,
ophthalmology,
ophthalmology.
and ophthalmology hates me. It's not that it dislikes me, it hates me. So basically, I studied opthal a lot because I didn't understand it. I'm like,
That's why you were
everything.
posting so much about
Yeah, I was
ophthalmology.
like, okay, let me just make mind maps. Let me just try to, register things in my brain. But I'm like, oh, I see ophthalmology, and I'm like, everything's a red eye.
Re-
Everything's watering.
exactly.
Everything's just red. What do I do about it? So I was like, I know two things really well: cataract and glaucoma. I can't
Yeah.
confuse those two things. But then I come to visual field defects. I'm like, what? What was that about? There are graphs and stuff. I didn't choose math. I don't want math here. I don't want graphs and stuff. I just can't have that right now. So I think my obsession with ophthalmology was because I was so scared of it. I was so tortured by it that I was trying to, you know, torture myself to be good at it. I was like, if अब इतना किया है तो थोड़ा अच्छा ही कर लेते वैसा.
True.
So that way. So I think ophthalmology is not a bad subject. It's not, because I attended my ophthalmology postings in back in second year also. We started
Okay.
postings in second year itself. And I was actually good at it. I was among the few people who passed the end post exam. I was like, I was supposed to be good at this. Why am I so bad at it now? And I think the main reason is because we didn't get any kind of clinical exposure. We didn't act from images, you can't really differentiate.
Yeah. True.
But when you actually see the patient, when you actually see your faculty explaining the minute details to you, I didn't realize what the iris shadow looked like from the images. I was like, I need to see a patient. I was experimenting on my brother. I was like, let me see your iris shadow. I'm like, you can't see it as it's not possible. It's that way. Like, you can't really see everything through the books or through images. You need to have the patient in front of you to actually see.
True.
Oh, this is how a cataract looks like. Oh, this is how glaucoma is. This is how a post-op patient looks like. These are the kind of things you can see. Myopia is just not like दूर की नजर जाना, and hypermetropia is just not नजदीक की नजर जाना. It's a lot more than that when you read ophthalmology.
True.
So I think
So,
for
what books and resources did you use for ophthalmology?
I watched Utsav Bansal sir's videos on Marrow, and
Okay.
I studied from Khurana mainly. But towards the end, I was done with Khurana because it hated me like anything. So I came to Vinay Vijay Buradkar's review of ophthalmology, and I won't say that's a sufficient book at all. But for a few LAQ topics, you can just go through it to see that what you're supposed to write in the exam. Because from Khurana, you can't really write the whole LAQ. Cataract is for like 10 pages. You can't write 10 pages in a LAQ. Right? So for those things, you can refer a review book. Even Parsons is really good, but I had already purchased Khurana, so I didn't go for Parsons. But yeah, Parsons is also really good. I studied a few chapters from the PDF, and it's a pretty good book. I would say it's better than Khurana in some aspects. And
Okay. So, okay, you have more books?
no, and that's just about it.
Okay. So, let me ask you one thing. Do you, in your final exam, get any image-based questions or something like that?
Okay, so yeah, in practical exams, since because of COVID, we were not allowed to see patients. We had a case scenario which had the image of the eye, and I knew that it's a cataract, and they had given us a hint also. Like, it was because of the age of the patient.
Age
I
of
knew
the
that it's
person.
senile cataract. But then I was like, is it immature or mature? Where is the opacity? I can't really see the opacity.
See.
It's just orange and it's just black and it's just grey. What am I supposed to look at? And then they took the case scenario sheet, and I was like, yeah, I know this is senile, immature cataract, but I didn't see it.
Yeah.
I didn't actually
Just because
see
of the
it.
clinical scenario, you
Yeah,
got
and
it.
then my case viva comes up, and my sir, he's like, okay, where is the opacity? I'm like, sir, there. I'm literally doing this. It's just there. It's there. And he's like, but where? Can you point it? I'm like, sir, it's there. It's just there. And he's like, okay, now tell me the parts of the lens. I was like, sir, capsule, cortex, nucleus. I'm like, where do you see? I'm like, sir, it was a guess because I actually couldn't see it in the image. Okay, I was like, sir, the cortex. And he's like, correct. Why are you getting scared? I'm like, thank you, sir. I was just nervous. Trying to be smart at that time. Like, I was just nervous. I knew it. Of course, I knew it. So, I think with images, like at least a person like me who needs to see the patient, who needs to see everything in person, uh, you can't study. If you're a person like me, you can't study from images. It's not possible. And I think a lot of people, they do study from images. Like, maybe they are good visual learners when it comes to images
Yeah,
and videos
true.
and books, and maybe they can, but for me it was not possible. I couldn't. So I
Okay.
think that for people who are going to have postings, don't miss it. Go for it, attend it, even though it might be exhausting and boring, but do attend it.
Yeah.
Like, you'll learn
Yeah.
something at least.
Yeah. So, ophthalmology, learning more from postings is much more
Yes,
beneficial than seeing the images in the books.
definitely.
Definitely. Cool. So, I think we finished all subjects
Yes.
and ophthalmology, ENT, and PSM. So, okay, for all these subjects, do you have a main online resource you always followed, or many on or other online resources you followed here and there in these subjects?
Okay, so for ENT and Ophthal, definitely watch Marrow. The faculties
Okay.
are amazing, and you will understand a lot of concepts, especially ophthalmology. Utsav Bansal sir is absolutely amazing. He, the way he explained mainly the visual field effects, because that was something which I had a problem.
You struggled with, okay.
Usually people don't, but I did have a problem with it because I didn't actually understand how it was happening. And he explained it very well.
Very well.
So definitely watch Marrow for ENT and Ophthal. But for PSM, you can go for Prep Ladder. Vivek Jain, sir, he's really good. He even has an exam prep manual book, which is
Okay.
basically part given in a concise manner.
Okay.
But I think that's something which I use just for a few topics and not everything, because it's extremely point wise and you can't really digest those kind of point wise
Yeah.
topics that way. You can revise from it once you have read part, but definitely I wouldn't use it as my primary book for studying PSM.
Cool.
So I
So
think Marrow and Prep, that's it. More than enough.
that that's it. So if you are gearing up for the Indian exams and you're in an Indian medical school, Marrow and Prep would be fine. Any
Yes.
one of these would be fine. Okay, so next, come to the next question is you have a very successful Instagram page, or let's say a studygram page. And if you don't know what studygram, we already did a podcast with someone we both know, Happy
Yes.
Studies Man, about studygram. You can watch that. So yeah, you have a very successful studygram page. You crossed 10,000, I think 1-2 months ago. So
Yes.
congratulations on that.
Thank you.
And
Congratulations to
so
you too. You also crossed 10,000.
yeah, many people shared my page, including you, that make him reach 10,000, make him reach 10,000. Finally, it happened. I got the swipe up.
Yes.
So yeah, you have a very successful studygram page. We heard your whole rant about PSM, ENT, ophthalmology. How did you manage your time in third year, tackling your studygram, your subjects, your medical school posting, COVID? So how do you
Okay.
manage all of this?
Okay, so the best part about my third year was the lockdown. I was at home with good food, with the luxury of my own bed and my stationery and my entire study table setup. So I would say that everyone has 24 hours in the day, and when you don't have college, when you don't really have that many of online lectures to attend, you can do whatever you want to.
Whatever you
So
want.
that's what I did. I used to study from I think 6 o'clock to 12:30 till lunch, and after that in the afternoon I used to study for like 2 or 3 hours. And this was not every day. A lot of days I didn't study at all. And from 4 p.m. in the evening, I was free. I was just like watching Netflix with my mom, not going out actually, but cooking. That was something which everyone did during lockdown, and catching
Everyone
up with
became a
my
chef.
friends. Yeah, I am a pro. Now I can make the
Pro.
best chai and the best Maggie ever. Okay, I can make that.
That's a chef.
That's my chef. Okay, no,
Now I
I
wanna have
actually,
chai.
I actually did try a lot of other recipes, but coming back to how I managed my studygram,
Yeah.
so it was very difficult to, get content ideas when the resources are limited. I was like, okay, I'm
Yeah.
posting my notes again and again, but there's not much happening apart from that. So I started posting my art. I was like, I'm good at mandala art, so I'm just gonna do that. I'm just gonna post about it. Then I posted my dad's painting. I was like, let me do that too. And then after a point, I'll be honest, I was out of content ideas. So I
Okay.
experimented with my studies. I was like, I make mind maps. Why don't I introduce that concept of how I make it to the
Make
world?
it.
So let me do that. And I did that, and it was fun. It made me want to study more and make more mind maps so I can post them on Instagram. But I didn't post all of them because, just like my physiology professor, even you guys wouldn't understand it. That's how I write it. It might look pretty, but it's not that every mind map you could understand.
Yeah.
So I only posted the ones. I used to send it to my friend. I was like, do you understand this?
Understand this?
Do you understand this? Because she's also a medical student. She's like, do you understand? I was like, yeah, and I get the idea of it. I'm like, okay, then I'm posting this. It's all right. And the best part about my entire page is that my parents are so supportive. They're like, I click a picture, we're like, don't you know how to click a picture? Wait, let me click it for you. I'll do this. Wait, edit it properly. What are you doing? Write the caption properly. There's a mistake here. That's this. So they gave me constructive criticism and they appreciated me. Like, did you see you got like 200 likes on that picture of yours? I'm like, yes, I know, I saw that. Like 200, that's a lot. And then, so I think because of my parents also, dad used to get these little umbrellas and stuff for my desk decor. He was like, do it.
For
Put it in the
aesthetics.
pictures, yeah. Put it in the
Yeah.
pictures. Like, especially the iPad stand, which is basically a canvas easel.
Yeah.
That was my dad's idea. He told me, like, get that. That will be something unique. It will look good. I was like, okay,
Good.
let me get that. Let me just try it. And it was like, you want to change your table's appearance? Just get a cardboard and put a nice chart paper on it. I was like, that's a nice idea
That's
too.
a nice idea.
So I would say that a lot of creativity which I have, it comes from my dad. And my parents have helped me a lot with my studygram. They give me ideas, they're like, do this, do that. This is not perfect, this is not post worthy. Wait, let me take another click. And even my little brother, most of the pictures of me which I've posted, they're clicked by my brother.
By him.
Yeah. So I think when you have a very supportive family, regarding Instagram, so you can do it. You can do it
can do it.
alongside studying. And I didn't make Instagram my first priority. I made studying my first priority.
My first priority.
And my Instagram is all about my studying.
Studying, so
So
complements
it's
each
just-
other.
Yeah, it's like दोनों चीजें same पटरी पे है वैसा.
Yeah.
It's just that way. So
But you
I
still
think-
made sure studies is your first priority and you don't
Yes,
get
definitely.
carried away in the world of scrolling down and down and down
Yeah,
on Instagram.
I'll actually tell you. I still remember that I was really upset when one of my best posts didn't do that well. I was like, Dad, but no one liked it.
Been
And
there,
people are
done
not
that.
sharing it. People are not. And I was like, this is not me. I don't really care about the numbers. It's not who I am. 4,000 followers, 400 followers, or 10,000 followers. It doesn't really matter to me. Okay, because yes, the number, of course, it feels good that so many people
Yeah.
are following you, so many people are looking
Yeah,
up to you.
true.
But no, it's not something which defines you. I think Apurva also said
Yeah.
that it's not something
Yeah.
which
I think that
validates you or
defines you. Yeah.
defines you. And I so agree with her on this one, because it changes how people see you in some way. Like, I realize I face that change a little, but I would not talk more about it. But yeah, it's just that you should know where to put your time in. You should know your priorities. If you become a doctor, your Instagram will have just much more content. So think about that.
Yeah. Yeah.
Focus on becoming a doctor first, and then focus on your studygram. Because if you don't post for a week or for a month, it's fine. You have to look
World will
after
go on
your
without
studies
you
and
as
stuff.
well. Yeah.
Yeah. So people are not living for you. So you're not that
Yeah.
important also. So just do your thing and come back when it's healthy for you to come back on
Come
Instagram,
back.
because I think social media can take a really heavy mental toll on you too. Like, in between, I did experience hate and stuff, and it was very difficult
Yeah.
for me to, I had to think not just 10 times but 100 times before I posted something, before I said something. Because what would someone have against a studygram page?
Study grammar.
Because I usually don't post things which I'm not completely informed about. That's very important. But
Yeah.
one day I did post something about, it was regarding some political issue only, and I was like, someone was like, you shouldn't say that. You're an Indian or what? I'm like,
If you say anything
no.
about politics on
I'm
social
like,
media, you're gonna get a
yeah,
good side of it and the bad side
yeah,
of it.
there were like only 30 views on that, and I already got one hate comment, and I deleted it. I'm like, I can't do this. It's not that I'm scared to, put myself out there and actually fight for what I believe in. But if I think that I'm not informed enough, like that guy, he sent
Then
me a piece which was contradicting which was contradicting
your
what I
views.
posted, and then I realized that
Yeah.
it might not be the right thing which I posted, so I deleted it. So I think instead of
True.
taking it on yourself too harshly, you should learn from your mistakes. That's
True.
what I would tell everyone who holds a social media account. But the thing is
True.
that social media trials can also take a huge toll on you. Like, people are at trial for everything, even though if they are innocent. So
Yeah.
I think that way you have to be very cautious about what you speak, what you post, and what you comment on other people's posts. Like, you can't
As well.
throw hate just like that. You
Yeah.
can't. You shouldn't.
And
So
there's no
that way, I
reason
think,
I
yeah.
believe.
So I think social media has its perks, like a lot
And
of
its
perks,
cons.
but still, it has the bad part too. And
It's
one
a
needs to
double-edged
step
sword.
away when it's required.
So basically, you as a person got your priorities straight. You understood what needs to be done first, and then you also understood how to handle these hate comments or whatever you get, and how to appreciate the good comments you get, how to take the love and appreciation from that, get motivated, post more content. So this was a whole another life journey for you.
Yes, yes, definitely.
Cool. So one thing about Instagram is there are trends, there are challenges, there are
Yeah.
these sort of things. There's one thing is going paperless, and
Yes.
I don't think so you're paperless, but what are your views on going paperless? Just using your laptop or your iPad to take notes or study from it. What are your
I
views on that?
Okay, so now I'm going to be going completely paperless, except for my postings, because there I need to take notes in my notebook. But apart
Yeah.
from that, I'm going completely paperless, because final year subjects are quite heavy, and I can't make notes for everything. And one shouldn't make notes for everything. It's just a waste of time, I think, if you make notes for everything. So
Okay.
yes, I did try my hand with the digital notes in third year also. But I loved the idea of using my fancy stationery and just making pretty things on the paper and stuff. But yes, it is extremely time consuming and not worth it. So I
Not worth
am
it.
definitely gonna suggest people to go paperless. If you can't afford some tablet or something like that, it's fine. You can like type it out. Like, I think
Many
that you can
people
type it out
actually
on your phone also.
prefer many people actually prefer having, like, for example, they have this dilemma okay, I have money to buy one thing, either a laptop or an iPad with an Apple Pencil. Both are pretty expensive.
Yes.
So I cannot afford to buy both the things. So for college, they ask, what should I buy? And I have had tons of DM asking which iPad should I buy, or should I buy a laptop instead. I found out people are fascinated by the aspect of, taking notes on an iPad with an Apple Pencil. You don't need highlighters, markers. It's all in this Apple Pencil. It's all digital. You can change the color. That are the pros of it. But then also people are like, okay, I might have to make some PPT or something. I can do it on iPad, better on a laptop, like people, stuff like that. So basically, I have seen some people, they're like, never mind, I can still write on my paper, but I need a computer for my college life. And then they end up writing the notes there also. So then they become paperless like that. So, what is your take on it? If you had a choice between a laptop and an iPad for your third
iPad,
year or your medical school,
definitely.
let's not. So, what would you
iPad,
take?
definitely. I
iPad,
love
definitely.
iPads, and I think they are the best investment because the best part about it is they don't really go outdated that often. Like they work for
Yeah,
years, like 5, 6 years
years.
straight.
Yeah,
They
my
can
iPad
work.
is like 4 years old, and so my iPad is with the bezels, not the new one. So when I have a video and I'm writing on the Apple Pencil on my iPad, they're like, "How are you doing this on this iPad?" I'm like, "Yes, this was the first one I bought with the Apple Pencil. Doesn't come out anymore." People usually say the iPad, I think, which you have without the bezels, the iPad, the newer iPad Pros. So then they ask me, which iPad are you using? It's with bezels and you're writing notes. I'm like, yeah, it's this one. So yeah, that's about iPad. So you think, and I think iPad is more necessary in an Indian medical school scenario because the applications, Marrow
Yes,
and Prep
definitely.
Ladder, the two most used, I guess, the videos don't work on the laptop, right?
Laptop they don't. So also I think that iPads are pretty convenient because you can actually make amazing visual notes with the iPad, which you can't with the paper. Like you can't print out the diagrams and stuff, and you can't certainly paint the diagrams or those things, right?
True.
So that way, I think iPad is an investment, and it will definitely help you, you know, make better notes and actually have everything in one place, but it's not a necessity. You
It's not
can
a necessity.
yeah,
That's
it's
it's
not a
a good thing.
necessity at all. You don't need an iPad to do well in medical school. That is something
Of course.
which people get a wrong idea of from my
Yeah.
page. So like, you are always on your iPad. I'm like, because I have it, but that doesn't mean that
Mean you
I
need it.
need it to survive or get through medical
Yeah.
school. I can do just fine without it.
Just true. Okay, that's the important message here.
Yes.
You go paperless, but you don't need an iPad to do that.
Yeah.
Cool. So you also take a lot of notes. So
Yes.
let's have your views about notes. What do you prefer? Take first of all, do you like taking notes? Second, if you like taking notes or if you like notes in general, do you prefer pre-made notes or you the ones you make your own, your handmade notes?
Okay, I'm obsessed with making notes. Firstly,
Yeah, I've seen
because
that. Why did I
I
ask
yeah
this question?
yeah I am obsessed with making notes. That's because that's something which I love. Like I get a lot of questions like, why do you waste your time making notes? I'm like, I don't waste my time making notes because I actually use them later on. And second thing, I don't make notes for everything. You can't make
True.
notes for
Make
everything.
notes for
You
everything. Yeah.
have to be selective. You have to filter out everything that, yes, for this I need to make notes, for this I don't.
Don't
So
need to make.
once you, I think I have mastered that filtering process where I know for what topic I need to make
Topic
a
I need
note,
to.
to take notes on, and for what I don't need. Okay, so once you learn how to do that, making notes is totally worth it. But yes, if you are a slow writer, if you don't know how to make good notes, making linear notes by just copying down what's written in the textbook is useless. People who do
True.
that, you are wasting your time. don't do it. Make
Hmm.
mind maps, make spider maps, like make notes which you can relate to, right? Because if you are just writing down what's given in the textbook, read the textbook
That's
instead,
not Merinos. Yeah,
right?
true.
So I think if you are a person who doesn't like taking notes, you can
Hmm.
use a proper highlighter system. Like I color
Yeah,
code my highlighters, and that's
lighters.
it. You just need three highlighters. There are three main things in
I
medicine, and
do
you
the
just need
same
three.
thing.
Yeah,
I do the same thing. For treatments, I use green. For causes, I use red. And for definitions, I use or yellow. And for the rest of the things which do not fit in these categories, I use blue. I think I have these here with me, right next to me. These four highlighters I use on my book. So
definitely. Like
whenever I need to see the treatment, I'm like, where's my green highlighter? Let me see the treatment. That's
if
like
you
a good
see,
thing.
if you see my textbooks, I have so many things written in between the lines. Like I used to be a person who had clean textbooks, okay, like perfectly clean, perfectly straight lines and everything till first and second year, and then a disaster happened and I stopped all of that, and I was like, this is what I understand, this is what I remember related to it, so I'm just gonna write it down there. And it's a
Hmm.
mess. I still remember when one of my friends saw my textbook, she was like, are you okay? I'm like, I'm totally okay. This is normal, okay? This is what medical students do.
Let's
So
do.
this is normal. You should also do this. So it's just that everyone has different techniques of, registering information in their brain. Like when I'm reading something, I'm just like, okay, I think this is a process and I'm just going to make a flowchart about it. So
Flowchart
I
about it.
don't make a proper note or a proper, beautiful mind map about it. I just make a rough mind map just for my understanding. It doesn't have to be
True.
pretty, it doesn't have to have perfect handwriting or full stops or punctuations or anything. It just has to be scribbled away for your understanding. So
Yeah.
if you are a person who can study like that, continue. You don't need to make notes. But yes, for
True.
some things like for
But
some
I think
high
it
yield
also
points,
depends on the. It also depends on the book. For example, let me give you an example of final year medical student. Final year medical school. If you're studying from, if you take Harrison's, and you start to study whatever topic, asthma for Harrison's, you you cannot. I mean, you can, but if you want to, you can understand, but I don't think so for a final year medical student, which I am. Not worth my time to go through 20 pages just about asthma. I have lot of other topics to cover. I cannot study 20 pages of Harrison's just for asthma. And then, for example, you study those 20 pages, you're like, wow, I have so much information now. And then you're like, how should I revise this? Like, I'm not gonna read. That's worst way of revision. I want to actively recall, but how should I do it? You need notes for that, or you need
yeah.
what most people do: chuck Harrison's away and get another book like Davidson's or Matthews or whatever, Chamberlain. A lot of books there. So I think it also depends on the book. If the book is not very student friendly, people start to take notes. If the book is super student friendly, like Matthews for medicine, if you see, it is in a question and answer format. The question is
Yeah.
written: what is the treatment for asthma? What are the different groups you need for the treatment of asthma? There's the answer in a point wise manner, in a subheading manner. So if you take notes from Matthews, I would say you don't really need to. You can just highlight, and if you're that sort of. But if you are taking notes from Harrison's, I think it's perfectly, a sane person would do that. In my
Yeah.
opinion, it depends on the
Yeah,
book,
but
I guess.
yeah, also something about Harris is like, and now you mentioned it. Harrison's is not for undergraduates at all. It's
True, true. But
not
for
at
example,
all.
my university, I have my final year exams. They have given me a topic list. You have to study cardiomyopathies, ECG, whatever, all of these things in medicine, and then they have mentioned the source, Harrison's this edition. I'm like, first of all, I'm not gonna do that. Literally have my Matthew sitting right here in front of me, which is calling me like, don't study Harrison's. It's not for you. So the book depends, I guess. If you study from Harrison's, you should make notes. If you're studying from Matthews, let's say for example, medicine, I don't think so. You need to make notes.
No, not at all. And something about medicine, like I started studying medicine in my third year as well. Okay, so now I'm gonna mention this in detail also. So when you're in third year, you just have three subjects, right? So ENT and Ophthalmology are pretty quick to finish. Like you can finish them within 2-3 months itself. And your third year is going to be for like 10 months or something like that. So you can start studying OBGYN or at least one or two systems of medicine side by side. I finished nephrology and I did a bit of OBGYN too. I don't remember any of it, but I did it. Okay. Because the worst part was that I didn't actually revise it properly. Okay, I made notes and everything, and the worst thing happened to me. All of my notes were deleted in my iPad's formatting. So I made proper notes for nephrology.
That's the con about going paperless.
I cried, okay? I cried.
Well, you should back up. You should have a backup.
I was about to back up and everything, but then I was just too lazy because in lockdown everyone was lazy. So was I. I was like, I'll do it later. Let me just not sync it with iCloud. Let me just, be free and not do anything. And that cost me a lot. Like those notes, they were gold, okay? Because they were really good. Because I did refer Harrison for it because at that time I didn't know that one is not supposed to study from Harrison's without revising.
You can. I think people do. For me personally, I'm sorry. I'm not going to do Harrison's.
I talked to my medicine faculties and they were like, who asked you to read Harrison's? Like, it's for postgraduates. You won't understand it. And she was right. I didn't understand it.
Yeah.
I started reading nephrology and I was like, but I don't know this. How do I understand this? It was just so much of new information for me. I was like, I can't do this before revising my physio and before revising my patho and pharmac. I can't do this. I can't read from this. So then I started using Matthew and I have seen people make notes from Matthews. I'm like, you can't make notes out of notes.
Out of notes.
It's just
you can just underline. There are still some points which are not relevant even in Matthews. I think you can get away with underlining.
So I was like, what is the point of making notes out of notes? Because Matthews is basically someone else's notes. That's what I think see it as. So notes is like, if you really like making notes and if you know what topic to make notes for and what to not make notes for, then you should go for it. But if you can't differentiate between these things, don't waste your time.
Don't make notes.
Not worth it at all.
Cool. So I think we've covered everything about notes.
Yes.
Last, I think, should be the last topic. I think, what are your final tips for third prof exams? If I'm not wrong, that's how you call it. Or if I'm wrong, correct me.
Third prof exams, yes. Okay, so for ENT, definitely follow the pattern. Definition, etiology, signs and symptoms, investigations, diagnosis and treatment. For ophthalmology, it's pretty much the same pattern, but make sure that you revise it thoroughly. You read it again and again. Don't get confused because in ophthalmology, everything is a red eye and you need to differentiate what kind of red eye it is. There'll be like differentiations like gradual painless loss of vision, gradual painful loss of vision, sudden painful loss of vision, sudden painless loss of vision. So those are the things which you need to cram and which you need to register in your brain really well so that you don't get confused in the exam or during the viva, because it's very easy to get confused in opthal. So make tables, make flowcharts of things which you are not understanding or which you think you are confusing it with something. Make tables, differentiate it. So I think that's something which you should definitely do. And for PSM, read it every day, read it again and again.
We had a whole rant about it.
Yeah. Consider it to be a Bhagavad Gita and sare shlok yaad hone chahiye. It's just that. So I think these tips you follow and you're good to go.
So third year will go like a breeze.
Yes.
So if you're watching this and you're in entering third year or you're about to enter third year, remember these tips. This is like the summary of whatever we talked about. So if you didn't have time, you just remember this. And I think, yeah, that's about it. Any last words for the people who are watching this or the people who are getting inspired by this and who are entering in third year? What would you like to say to them?
I'd like to say, tell this to them that no matter how frustrating it gets to study ophthalmology when you get confused, or to read PSM when you think like you don't remember anything, trust your residual memory, trust your instincts, and just trust yourself that yes, you have studied this, and don't be frustrated before exams, because that will mess it up. I did that, and I don't want anyone else to make that mistake again.
Okay, and I would like to add, if you if you hated biochemistry, if you hated microbiology, if you hated histology, you're gonna appreciate them right now in third year after studying PSM. That's
Yes,
my
they did.
takeaway from third year in Indian medical school. So I guess that's about it. It was really fun chatting with you, and I hope a lot of your viewers and my viewers and people watching this gain a lot of information from this and insight into third year of medical school in India. And it was great having you.
Thank you so much for having me. It was amazing chatting.